with another piece of super interesting and culturally relevant research that I wish everybody knew about. Today we're going to be talking more about childhood trauma and your teeth. We have known about disparities in dental health based on individual socioeconomic status for a really long time. Essentially, for those who do not have a lot of financial resources, do not have a lot of social resources, are part of marginalized communities, dental health is poor. And this has always been attributed to lack of access to care. Well, if you don't have the money, you don't have the access, you don't get your teeth taken care of. It's also sometimes been attributed to different attitudes about dental health. What does that mean? But what people don't talk about is the direct correlation between childhood trauma and adversity and dental health. And it's probably not a surprise that those who are experiencing low SES or marginalization in some other ways are more likely to have childhood adversities and trauma. But there's newer research showing that even when we control for SES, control for racial or ethnic group, control for how much dental care you've received, there is still an association between trauma and dental health. Basically, what that means is the explanation for why individuals who have experienced childhood adversity and trauma have poor dental health is not because they're not getting their teeth taken care of. So what does trauma in and of itself have to do with the health of your teeth? If you saw my other recent post on this, you know that your teeth are acting very similar to the rings of a tree during childhood. They are coding information in rings about what's happened in your life. And researchers are now able to take somebody's baby tooth and identify the day at which a large stressor occurred just by looking at their teeth. So while we still don't know exactly why teeth are so impacted by childhood trauma, it doesn't really matter as far as the implications right now. If individuals who have suffered childhood adversity and trauma are their biggest patients, why aren't dentists learning about trauma-informed care? I am someone with a ton of unearned privilege who also experienced a lot of early childhood trauma, and my experiences at the dentist have been less than great. At one of my dentist visits in my 20s, I had 13 cavities and 3 cracked teeth that needed crowns. And I experienced the stigma and the shame in the office that comes with that. Do you know what I was told to do? Brush my teeth more. Do a better job flossing. So never mind having the resources to get to the dentist in the first place. What about the level of trauma that's introduced to already traumatized people by simply trying to get the care that they need for their teeth? Anyway, we obviously don't have all the answers, but I just wanted to share this with any other people who have experienced childhood adversity and trauma and have suffered with poor oral health. You didn't do anything to make this your fault. If you're interested in reading more, you can check out the articles in my bio.